Today, I'm going to be doing Get Ready With Me while I talk about diabetes prevention. So, I'm starting with primer, and the first thing you can do for diabetes prevention is being able to perform at least 150 minutes of exercise in a week. A lot of people, and especially adults, don't get to do this because of their work lives, but at least 30 minutes. So that would amount to, 30 minutes a day, and even if you exclude weekends, like, you could do 30 minutes a day, and that's still a very good amount to be able to ensure that you have a healthy, and leading into that, your next most important thing in being able to reduce your risk of diabetes is actually maintaining lower blood sugar and making sure that you're eating healthier carbs compared to, high starch, high fat foods. These high starch, high fat foods often have a high percentage of trans fats and processed sugars that aren't very good for your blood sugar. It can cause a huge spike in blood sugar, especially if you have a genetic risk for diabetes. Next thing going into that is having yearly checkups for your diabetes and just general blood sugar and things like that. These regular checkups can tell you a lot about your blood sugar and blood pressure levels, and often if you have high blood pressure and high blood sugar combined together, those can be especially risky because the blood vessels in our legs and eyes are very, very thin, and having high blood pressure and which can cause, clots and things like that, and then in addition having that high blood sugar can cause blockages in your arteries and veins, which can eventually, obviously it's not going to happen for everyone, but amputation. So yeah, another thing you can do to prevent diabetes is making sure you're prioritizing your fruits and vegetables. Many adults aren't able to do this due to having a heavy workload or, other factors like that. But it's important to prioritize having whole grains in your diet rather than white grains if you can help it. Although, socioeconomic status can prevent people from accessing the proper care they need in a lot of situations. Being able to have there's numerous programs out there that can help you, including help increase access to healthier foods, and especially people who are living in food deserts who it might be hard to gain access to anything except processed food. It's often the case with a lot of people with diabetes, because diabetes is known to have a higher risk for people who live in lower socioeconomic statuses and are experiencing poverty. And the last thing I want to talk about for diabetes prevention is diabetes prevention, and if you already have it, lifestyle, and decreasing your risk for it through lifestyle changes is being able to ensure that you have a support system, people who ensure you have a healthy diet. Although this might not seem important, but especially as you get older, having people who support you and who ensure you have a healthy diet, and having someone to, keep you strong through that process is important, because although you might not think that it's very important now, like later, especially when you get into your senior years, like 65 plus, that's something that a lot of older people tend to put on the back burner, with being able to taking care of their health all these years, and now being done with that, it's something that they tend to not see as important as other things in their life now that most of their formidable years are over. So it's important to ensure that elderly people have access to that. And yeah, that's my video.